My name is Steve Sundell, and this is Dave Devore.
I'm Dave Devore.
And we have been Shine counselors, Dave for about 15 years, and myself for about 10 years. We are the Easton Shine counselors, and Shine, S-H-I-N-E, stands for Serving Health Insurance Needs of Everyone. So we try to help people where we can. It's mostly with Medicare. And regarding Medicare, we can help people with initial enrollment once they're turning 65. We can help them when they're transitioning from a employer health plan into Medicare. We can also, if people have Social Security, they automatically get enrolled into Medicare at age 65. Also, we screen for public assistance programs. There are some things through Mass Health, whether it's Mass Health Standard or any of the Mass Health savings programs, which could pay for Part B. Prescription Advantage is another plan that helps pay for when the person has spent a large amount of money for prescriptions and is in the quote-unquote donut hole. And then we can also assist with Extra Help, which is a federal program which gives help for drug plans also. Just a quick description of Medicare. Medicare consists of Parts A, inpatient hospital coverage. Part B, which is outpatient services, meaning primary care visits, specialist visits, x-rays, lab tests, so on and so forth. Anything outside the hospital. Part C is Medicare Advantage plans. And those are your typical HMOs, PPOs, that type of thing, where you follow the rules of the plan as opposed to following the rules of Medicare, like you do if you have just A and B. And then another plan you can get is a supplement, which you hear called the Medigap. That helps people pay for the portions of Part A and B that they're responsible for. Also, we'll be talking about drug plans also. So that is Part D. So A, B, C, D, and then supplement plans, like I say, work with Parts A and B. During open enrollment, which is the basis of what we're going to talk about today, open enrollment starts on October 15th and goes until December 7th. And open enrollment allows you to change your existing drug plan or Medicare Advantage plan to take effect January 1st of 2021. Now, we don't have any plan information yet. We should get that hopefully in the next week or so. And then these changes don't go into effect until, like I say, January 1st. We can, further back, the Easton COA has been closed since March because of COVID. So we are not doing any in-person counseling sessions like we have done through the past 15 years. So we will be doing everything by telephone. So we have people that have been calling already, and we have a big list already. Some people that Dave has seen through the years, some people I've seen through the years, and I'm sure there'll be a lot of new people. But be reassured that once your name goes on the list, that you will get a call from either Dave or myself. So these phone calls will allow us to explain any questions you might have. Whether you're new to Medicare, so we could explain, Medicare Advantage plans, PPOs, HMOs, or supplement plans, and we could explain Parts A and B, which is just regular Medicare, the inpatient hospital Part A and the Part B outpatient services. All of those, or at least most of the Medicare Advantage plans and the drug plans, Part D, change from year to year, so that deductibles change, the premiums almost always change, and co-pays, what you pay for when you go into the pharmacy, that changes from year to year also. So what we do when you call up And when you call up, make sure you have your Medicare card, your health plan card, whether it's a supplement or an HMO or a PPO, and your drug card, your prescription drug plan. And along with that, your list of prescriptions, the dosage, and the quantity. So when you call with that information, if you're looking to change drug plans, let's say, or just looking for your best plan for next year, for 2021, because that's usually our objective, is to try and figure out what the best plan is going to be for you for next year. Like I say, things change from year to year, and our objective is to try and have you save some money, hopefully with the best plan. So we can go through the list. We will go on to the Medicare site and find the best plan for you. Once we do that, if you're satisfied with that, we can enroll you online. Again, we'll need your Medicare number and so on and so forth. And we can send you all the information, mail you all the drug lists, the appropriate information regarding that, along with a confirmation if we do enroll you online. With that, if you have access to a computer, Medicare.gov is a great website which explains most everything. It's a federal website sponsored by Medicare, so it'll explain parts A, B, C, D, supplements, so on and so forth. So if you have access to a computer, that is a good basis to start your analysis on what you might want to do. If you're in there and you're computer literate, you can also try and create a My Medicare account. So that would allow you to look at drug plans, check and see actually anything that goes through Medicare, so you can see your bills and any type of information related to Medicare. It takes a few minutes to set up because they're always looking for a specific username, password, so on and so forth. Three questions that you need to answer also. But it's very beneficial to be able to do that. Now again, that is something that we could do or help you with when we speak with you on the phone. Further, when you call, you'll be calling the Easton Council on Aging to set up appointments. And that number, 508-230-0690. And you can either ask for Dave if you've talked with him in the past, or ask for me if you've talked with me in the past, or just just go on the list, and our secretary there will set up an appointment. And be rest assured that you will get a phone call in return regarding this. And again, it's not just changing HMO plans or PPO and drug plans. We can talk about and hopefully explain anything about Medicare, any type of questions that you might have. Dave, anything else that I've missed?
No, I think you covered things pretty well, Steve. Again, I'm going to try to do a lot of this over the phone with folks. When I call or you call me, if we can get the name of the drug, spell it out. That's important because we have to have the right spelling to call it up on the website. And the dosage and the number of pills you're taking a day is important. And then once we factor all this information in, we get a list of drug plans that are available, and we look at the least cost plan, which has a preferred pharmacy that you prefer to use. Each plan does have what they call preferred pharmacies, standard pharmacies, and out-of-network pharmacies. And you want a plan where the preferred pharmacy is a pharmacy of your choice: CVS, Walgreens, Walmart, Costco, if there's one around anymore. So that's the kind of information we need. And then once we get that, we can then relay this information to you and either change the plan for you or give you confidence that you're in the current plan is the best one for you for 2021. I don't have anything else to add.
And just one other point, a preferred pharmacy is usually much less expensive than a standard pharmacy, so that if you're at a particular pharmacy and it's not a preferred pharmacy, all it would take is the doctor sending the prescriptions to a preferred pharmacy, which might be able to save you some money. And again, that's really kind of our objective here, is to try and get the best plan for you for next year, for 2021. And also, you know, we can hopefully explain anything about Medicare, you know, initial enrollment, going through transitioning from an employer plan, or whatever else it might be. And I think that's about it. Thank you.
Yep, thank you. Hope to hear from you.